Hi, my name is Greg Schindler with the Regen Room. I wanted to take a few minutes and share with you a little bit about our approach to regenerative medicine at the Regen Room. You know, a lot of times you'll find that people approach this new and exciting space in healthcare with a one-size-fits-all mentality. And it is not that. Every patient, every indication, every injury is different. And so it makes sense that the therapy and the treatment recommendation from the physician should be personalized to that particular patient and their pain, right? So at the Regen Room, we've curated a premium portfolio of regenerative medicine products and therapies and an algorithm that only comes from deep experience and years of practicing regenerative medicine. As one of the most exciting and fastest growing sectors of healthcare, regenerative medicine is filling a gap between traditional medicine, medications, painkillers, and surgery. And it's long overdue, but it's provided physicians with options to treat their patients that they haven't had before. And we at the Regen Room are super excited to bring this to you, to all of our patients, and impact change lives. We see it every day in the clinic, and we're excited. I'd like to introduce you to our medical director at the Regen Room, Dr. Scott Waugh. Dr. Waugh has over 10 years experience in regenerative medicine. He's a board-certified medical doctor, and I don't believe that I've ever encountered a physician who is more intensely focused on outcomes for their patients. This comes from deep understanding and caring about each and every patient that comes through the Regen Room.
Hi everybody, I'm Dr. Scott Waugh. I'm a board-certified physician in sports medicine and family practice, and I've got 10 years experience in regenerative medicine. So I want to tell you what the Regen Room can do for you. We have a package of premium therapies that have proven countless times over the years for me and many of my patients that we can have positive results and get you out of pain and get you back on the road to recovery doing the things that you love to do. The reason I'm here today is to share this with you and give you access to the seminar. Whether you were able to come and you need a refresher, you couldn't remember everything that was in there because I know there's a lot of information packed in, or you weren't able to make it due to some unforeseen circumstances, or if this is a video that you would like to share with friends and family. So this is for you to have access to this information so we can really make a difference in your life or in someone that you love. So I'm going to start by first telling you a little bit about who we've treated. Opportunity to make a difference in a lot of people's lives. I'm very proud of that. And some of those people happen to be professional athletes. Some are college athletes. Some are weekend warriors. But most people are just like you. So we have people like Craig and Sheila and Jenny and Larry that need help, that want to be more active, that need to get up off the couch so they can live the life they want to live. So we help you get out of pain. If you have a medical condition that's keeping you from doing the activities that you love to do, this is a great place to start. So let's talk about how we get here in the first place. What happens over time as our body begins to break down with age? And there really are two different categories here. We have the controllable effects that cause degeneration. Those are things like weight gain, poor nutrition, lack of exercise. As we all know with work, most of the time we have to sit around all day anyway. It's not a good thing for us. And we lose our ability to maintain good strength around our muscles and we have more instability. And then there's a second bucket, is stress. And the last would be the endocrine system. And so all three of these things, our lifestyle, stress management, and endocrine function are super important for how our body degenerates. On the other hand, we have the uncontrollable factors. Now, most people know that those are your uh-oh moments. Those are your slip and falls, your car accidents, things that cause physical damage to your body, whether it be a broken bone, a torn muscle, tendon, ligament, those types of things. So we have controllable and we have uncontrollable factors that lead to degeneration. So what about you? You only have one body. And we know that if you have degeneration, which happens with time, that you have inflammation. And with inflammation, more than likely, you're eventually going to have pain. Chronic inflammation is defined by the medical community as pain lasting longer than 3 months. And we know it's indicative of a degenerative condition. And what happens with degenerative conditions? They always get worse over time. So let's look at what could be going on with your body. Here we have a knee that shows stage 1 arthritis. What happens if you don't intervene at this point? You can see there's a small area of redness on the right side of the knee, which is evidence of exposed bone. we have degeneration and thinning of that cartilage. If we don't do something here, it will get worse. We'll end up at stage 2. Now you can see that there's more cartilage loss. So now you can see there's a little bit on the left side of the joint as well. These are the preferred times that we should intervene with some of our results or some of our protocols. This is where we get the very best results. What happens though if you don't do anything in stage 2? We end up at stage 3. This is when things start to look very desperate. You can see in the x-ray at the bottom that there's very little joint space left at all. Believe it or not, we can still make an impact in joints like this. So we believe that the protocols that we have produce great results even in stage 3. So it wasn't that long ago that when you got to stage 3 arthritis that I was referring my patients to orthopedic surgery. There was no other option besides joint replacement surgery for stage 3 and stage 4 arthritis. Thankfully, we have protocols that can significantly make a difference in how this knee looks over time and can do the same thing for your joints. So what are your options? We have several standard of care options in the medical community these days. The one I want you to remember the most is you can always do nothing. I don't prefer that, especially if things are degenerating. I would like to do something different. If we look at the next step, surgery could be an option. And I promise you this, as the medical director of the Regen Room, I take great pride in being ethical and honest with my patients. And if I don't think that you're a candidate for regenerative therapy, or I think that surgery could be a benefit to you, I'll tell you. And I hope that my staff, I demand that my staff tell you as well. The next thing that's an option that I still use even in conjunction with this are the manual therapies and physical therapy and chiropractic and home exercises. Those are a critical treatment option for everyone, including myself. But along the way, you've probably tried it and it wasn't enough to significantly alter the course of your disease progress. The last thing you could do is you could continue to use more medication, whether that's an oral medication, a topical medication, an injectable medication. And I suspect that most of you have tried most of those things. And I would expect that since you're here, you probably agree with me that they're not great treatment options. They're just Band-Aids, and they all carry with them significant side effects and risks that now that we have regenerative therapy, potentially we can avoid. And so if you look at number 5 with regenerative medicine, this is something that I'm very passionate about, and I feel like we have a great chance to turn back the hands of time for you. So let's talk a little bit more about those medications I was just mentioning. So what are the risks? I'm sure that most of you have been on or may still be on anti-inflammatory medications like ibuprofen or Aleve or Celebrex. Those things all target the inflammation, but they're not doing anything to interrupt the root cause of your degenerative condition. They all have side effects. They can affect your gastric mucosa and gastric health. They can cause bleeding and ulcers. They also are very harmful for your kidneys over time. They can elevate blood pressure. You can see just because it's over the counter doesn't mean that it's safe. And so we would like to, if we need to use those in the short term, most of the time that's okay, but the goal with what we do is to give you treatment that reduces inflammation and gets to the root cause of that inflammation, thereby helping offset that progression towards the degeneration that you have. The next thing we're going to look at is we're going to look at muscle relaxers. Those tend to work okay from time to time, but they can cause a lot of drowsiness. And the older you get, the more likely you are that you're going to fall and you're going to end up with a broken hip or a broken shoulder. And then you're looking at a surgery. So I'd like to get you off of those as well. And then lastly, and we've all seen in the news the attention by the legislature and everyone else about narcotics and painkillers. They are terrible for long-term control of pain. They have so many side effects. I don't even want to list them all here. The one that everybody has the most attention these days is the habit forming or dependence that they develop, and then the sudden death. And just the respiratory suppression and all those things. It's just obviously we want to try to avoid those if we can. The last thing we'll talk about here are the injections. And steroid injections, although they can be beneficial when things are very swollen, very inflamed, and very painful, I pride myself in not using them when I can. Because guess what they do? They cause more degeneration of your cartilage. They cause more degeneration and thinning of your bone. They are just not good. And that's not even counting the systemic effects like cataracts and weight gain and blood sugar problems. So obviously, we would rather not use those. And if we have to, it's in very small doses and very infrequently. So we need to change the way we think, right? We said this, you only have one body. Let's think about your car for a minute. You can buy a new car, right? You can't buy a new body. And if your engine light comes on in your car, what are you going to do? If you take it into the shop and the mechanic just puts a piece of tape over that light, that doesn't make you feel very good. You're going to go, hey guy, you didn't fix anything. You just put a Band-Aid over it. It's not doing anything to fix my car. You would understand that you needed to do more to improve the way that car is functioning. It's the same thing with the body. All of those things we just mentioned, the narcotics, the injections, the anti-inflammatories, they're Band-Aids. So let's get to the root. Let's figure out what's causing the degeneration and the inflammation, and we can tailor a program for you to help start that process. So what's needed for you? So we've seen that we have inflammation. That's an important part. But what we need to do when it's time to make a difference in how your body responds and to start to reverse this degenerative process and improve the healing response, we need to improve the quality or the state of the tissue and the joint that we're treating. So you'll see here at number 2, it says a pristine microenvironment. I want you to go with me real quick with an analogy. I want you to think about a garden. If you have a garden and you're going to plant tomatoes, you're not going to plant it in the middle of a bunch of weeds. You're going to till the garden, you're going to pick the weeds, you're going to clean everything up before you put those seeds in the ground. So the same thing has to occur for us to have a productive treatment with good results. We need to clean up that microenvironment, and we have just the products that can do that. The next thing that we're going to do is we're going to use either or, in some cases both, stem cells and growth factors to stimulate the healing response and start to reverse that process. So let's talk a little bit about stem cells. So your stem cells, and we said this a minute ago, there aren't as many of them. They're as old as you are, and they're not as active as they used to be. So you can see here on this slide that when you're born, you have 1 in 10,000 cells that are actual MSCs or mesenchymal stem cells. As we get older, you can see relatively quickly through our teenage years, that drops off significantly, and it continues to do so over time. So using your own stem cells to heal and or to treat you becomes more difficult as we get older. So stem cells are weaker as we age, and the number of growth factors is much lower. So our ability to heal on our own is significantly decreased, and that's where we come in. That's where we provide growth factors and other healing mediators to help you improve, stop degeneration, and get your function back. So let's talk about the types of regenerative cell therapies that are out there. I'm going to divide this into 2 broad categories. We have therapies that come from you, or autologous therapies, and then we have allogeneic therapies that typically come from donated placental tissues after the birth of a live, healthy baby. So the first part, we talk about bone marrow and adipose tissue. We can also talk about platelet therapies that are growth factors that don't have any stem cells in them, but those things might be used in some combination to help you. So let's talk about the different types of regenerative cell therapies. You can see on this slide there's several different types of therapies that we can use, and it's our job to find out what fits you best. So we're going to take your history and your age, your specific condition, and find the right treatment option for you. So for example, bone marrow aspirate is a great treatment option for many people. But as we saw just a little bit ago on the slide showing the decline in stem cells with age, once you get past about 65, it isn't a great option. Now let's talk about the right side of the screen. You'll see the allogeneic products like cord tissue, which includes a product called Wharton's jelly, which has a matrix of proteins and other growth factors and cells that help you regenerate. Then we also have other growth factor products like a placental matrix that has those same factors that can help. And so it's our job to find which one fits you best, but this is a great treatment option for people that are over age 65 and or who don't have stem cells that are as active as they need to be to heal. If you've made a commitment to get out of pain, you've made it this far, call the phone number and come see us for a free consultation. So as a doctor, I can't make any guarantees about your health. But I can guarantee one thing. If you don't do anything, it will continue to get worse. We look forward to seeing you at the Regen Room. Call the number on your screen today and come see us.